address affordable health care again. To be a hot topic this evening and
Sure.
About the last couple of years. And just from our perspective, we're self-employed people who have lived in New Hampshire for over 5 years now. And we chose to live in New Hampshire because of the tax structure in the state. So it would be a good place to live, plus enjoy the outdoor activities here. With the passage of this, we thought this is great. More people in the insurance pool, our insurance rates should go down. If we had our old policy, we can keep that. I don't see a problem. What could possibly go wrong? But now we know that we were grandfathered into an existing plan. However, our rate just went up 40%. And if we were to switch over to the exchange, we can't do that because the rate would go up another couple $100 at minimum. And quite frankly, we're in the in-between where, we don't earn low enough to get subsidized. And, we're not in 1% by any stretch of the imagination. So probably a lot of people who are stuck in this middle, and I'm sure that there's a lot of people in the state of New Hampshire that are self-employed that are in the same boat where we're kind of stuck. And we're not, and if we were to go to the exchange, we'd lose a bunch of options as far as healthcare facilities go. Like Dartmouth Hitchcock, it's probably one of the best hospital systems in the country, if not the world, wouldn't be covered. We wouldn't be able to go there. So if we had some sort of disease that could be addressed at first-class health care facilities such as Dartmouth Hitchcock, we couldn't go because that wouldn't be part of the plan. So, to me, it seems like there's a lot of stuff that's broken in this thing, and I want to know how Congress is going to address those specific loopholes and issues that are coming up.
Well, thanks for your question, Dave. And clearly there's a lot of misinformation about the Affordable Care Act. One thing I do want to clarify is that Dartmouth Hitchcock is in the network, so if you were trying to get a plan on the exchange, Dartmouth Hitchcock would be covered. So you don't have to worry about that. There are some hospitals that are not covered, unfortunately, and I certainly hope that's going to change. And next year, when there are some more competitors in the exchange, hopefully that will change. Without knowing what your particular plan is, I can't address your situation, but I will have somebody follow up with you and see if there's anything that we can do to ensure that you have correct information, and that if there's any way that we can help you as you're looking at what might be available through the exchange, we're happy to try and do that. I've heard from people who do have some concerns. Obviously, the rollout didn't work well. We want to make sure that people who were going to lose their plans were grandfathered, and as you point out, hopefully your grandfathering worked, but that didn't guarantee the rates on those plans stay the same as before the health care law. As you know, they didn't stay the same either. So we're working to try and fix some of the concerns that we've heard from people, looking at what has to be included in terms of coverage for hospitals and providers in any network in the future. I think we need to take a look at that, and hopefully the state legislature is also doing that, because that's a law that the legislature passed to determine what was adequate to be in the network. So we are also looking at that at the federal level, and looking at some of the other concerns that we've heard from people about having enough time to enroll and having a transition period for grandfathered plans. So I think we do need to continue to look at what needs to change in order to make the law work better, and that's what I'm trying to do, and I hope you will continue to share with us concerns that you have so we can try and respond to them.